Go.
Hello, my name is Scott Carpenter. This is Phyllis Martin. We're going to discuss today risk management in healthcare. So I'll start off by giving you the definition of risk management. Risk management is the preventative process of managing risks. It involves identifying risks, strategizing ways to avoid or mitigate those risks, and developing a contingency plan in case risks cannot be prevented or avoided. According to the Medical and Public Health Law site, healthcare risk management goes beyond the protection of a business's operations and finances. It involves understanding how risks can impact the patients. The significance and one of the most important features of healthcare risk management is ensuring the continuity of patient care, and that's the most important thing. It means that hospitals, doctor offices have to consider how risks can be managed in a way that does not disrupt a patient's treatment. According to an August 2007 article in Healthcare Finance News, patients are negatively affected every year from risks that have impacted their treatment. Such as risk management is an essential part of the healthcare industry. According to a 2007 update to the University of Florida, risk management in healthcare is different than in other industries because there are so many specifications that need to be considered. For instance, pediatric risk management is different than geriatric risk management. Also, the healthcare industry differs from other industries in that there are risk management laws that hospitals and doctors' offices are bound to. As with any type of industry, healthcare administrators are concerned about the potential for operational and financial risks. If risks threaten or disaster impact a healthcare organization, it can have a snowball effect that trickles down to the patients, and of course the patients end up paying more money. According to the October 1997 issue of Nursing Homes, through performing risk analysis and ensuring best practices, healthcare administrators can do their share to protect the patients as well, and of course their company from harm. Unfortunately, patients are a vulnerable population when it comes to healthcare risks. According to the update by the ECRI Institute, there are many steps that healthcare companies can take to protect the patients from risk. Such steps include environmental safety, medication and pharmacy safety, fire safety, and of course, a real important one, infection control. Healthcare risk managers perform various investigation and analysis and evaluate risks in hospital office procedures and policies. The risk management manager makes sure healthcare provider is in compliance at all levels with insurance, benefits, employee and client services. Their responsibility is, as a healthcare risk manager, is to provide various hospital departments accurate and timely feedback and researching on the state and federal regulations. These departments include operations, sales, clinical, finance, legal, and other departments as necessary. The healthcare risk manager also recommends and formulates policies, procedures, and guidelines for departments. And they also collect the data to investigate the frequency and causes of claims or accidents to patients or employees. A person in this position may also serve a team in the risk management department and aid them with paperwork studies and operations and presentations of reports.
The qualifications for a risk manager is having a bachelor's degree in health education or healthcare management may be required. A person applying for this position will be asked to have a strong verbal and interpersonal skills because of a healthcare risk manager does a great deal of communicating and with department heads researching and writing reports. Traveling to various hospitals and clinics may also be required for this position. The experience, a minimum of 3 years working as a healthcare risk manager, may be necessary. Experience in presenting and putting together statistical material is vital. A healthcare risk manager must be proficient in Microsoft Excel, PowerPoint, and Word computer software. Previous experience reviewing and understanding healthcare data and interacting with patients and insurance carriers is useful. The environment a healthcare risk manager works in a busy office environment. It is important to dress professionally and have reliable transportation, as the job involves travel to client work sites and attendance at various seminars and conferences to remain updated on research and regulations in the healthcare industry. The risk manager's responsibility in hospital settings is, according to nursing and patient safety expert Thomas Sharon, around 100,000 people die in U.S. hospitals each year as a result of preventable oversights, accidents, incompetence, and negligence, with thousands more falling victims to infection, injury, and permanent disability. The hospital risk manager helps a hospital minimize these losses. The risk manager identifies risks, implements preventative measures, limits financial losses resulting from mishaps, and administrators risk management policies. Identifying the risk. Risk managers are responsible for identifying any areas of real or potential risk within the hospital. The hospital settings presents a multiple of risk, including medication error, patient falling out of beds, complication arising from high-risk treatments, misdiagnosis, and staff mistakes. By reviewing the hospital's current policy and procedures, they then identify possible gaps in the quality of patient care or staff and visitor safety. The hospital risk manager can identify risk and develop procedures to address them. Risk managers also identify risk by drawing information from incident reports and investigating past occurrences. Taking preventative measures. The hospital risk manager's responsibilities include establishing policy and procedures for preventing injuries to patients, staff, and visitors. Their proactive risk identification efforts result in the development and taking preventative measures. Hospital risk managers' responsibilities include establishing policies and procedures for preventing injury to patients, staff, and visitors. Their proactive risk identification efforts result in the development and implement of preventive measures. Hospital risk managers develop prevention initiatives by drawing conclusions from assessments and investigations about how incidents occur. They recommend necessary changes to prevent any further reoccurrence. Limiting financial loss. Risk managers are responsible for preventing and limiting any financial loss to the hospital and its employees that may result from an incident. The economic consequences of mishaps for hospitals are payments and legal costs, which can have a massive impact on the provider's profit margins. A risk manager also maintains a strong risk management record for the hospital, since this can have a positive effect on the healthcare provider's earnings, with the reputation serving as a powerful marketing tool, as well as positively affecting patient referrals. An effective risk management record can improve staff job satisfaction, resulting in higher retention rates and thus saving hospitals on recruitment and training expenses.
And that concludes our teaching of risk management in healthcare. And Phyllis and I just wanted to thank you all for listening, and good luck on your state boards.